I feel so free. Thank you so much.
Sometimes doing body work is just about like getting a little handhold somewhere. It's about creating a little movement somewhere and then starting to leverage that into more movement elsewhere. And there's a lot of bodywork systems out there that are very protocol heavy. You know, for an entrapment in the quadriceps, you lay the patient on their side and you flex the knee and you externally rotate the hip and you do this and you do that with your hands, and that's fine, but it takes away from your ability to feel what's happening in this patient's body and kind of intuit what needs to happen, and it takes away your ability to use trial and error. And trial and error can be so incredibly useful, and it only takes a couple of minutes to determine whether or not the person's body is responding to what you're doing. You know, observe their breathing. Are they relaxing? Are you starting to feel these tissues mobilize under your hand like I am now? And if so, then just keep doing what you're doing. So let's follow this up toward the psoas now. Okay, and here the tissues start to get a little bit more sensitive as you come up toward the hip joint itself. So it's nice to lighten up the pressure, not use the very tip of your finger, but more using the flat of the finger and broad contacts so that it doesn't feel too pinchy or too pokey. And right here is where we're really starting to get into some stuck territory. So let's continue with this rotational mobilization of your femur, okay? But what I want you to do is for you to roll your thigh like this and then relax. So you're going to internally rotate and relax. Yeah. And as you relax and externally rotate, I'm going to put some medial pressure on this superficial fascia here overlying the psoas, the rectus femoris, and the iliacus, and just start to release this, basically. If you need a break, let me know, okay? Okay, good. Keep going. Yep. Let's say 3 more good ones, okay? 1, 2, last one, and relax all the way. Good. So now I'm on the center of it. Feels like a trigger point in the psoas right here, and so gentle static pressure just for about a minute. Okay, does that feel all right? Good. I know you have been under a lot of stress lately, and we do, as humans, tend to put a lot of stress into this area of our body. So see if you can use your breath to kind of increase the pressure. Can you direct the breath all the way down into this deepest part of your pelvis here? Yeah, good one. Keep breathing like that. And as you do, I'm going to start using a little movement here. It feels to me like I'm able to really circumscribe the knot for you, and that's working better than the direct pressure was. That just let go really nicely. Did you feel anything shift in there?
Yeah.
What did that feel like for you?
Relief.
Felt like relief. Good. Yeah, that's moving way better. She is nice and relaxed and got her comfortably supported on the table here. Nice to have a prop under the top knee so that the hip stays in neutral. If the knee falls toward the table, the hip is going to be in a little bit of adduction, and it's going to be a little harder to feel. So in this position, I work a lot in this position because there's so many things you can access here. Starting from the top, you've got, well, the whole shoulder. We're not quite going there today, but for our purposes, we've got the lower rib cage, the diaphragm. If you're working on their right side, you got their liver and gallbladder. If you're working on their left side, you got their stomach and spleen. I have her quadratus lumborum here, all the layers of abdominal muscle here, and access to the iliacus and the iliac fossa here. All those things. And then the iliac crest, so many important attachments here from the internal oblique, the external oblique, the transverse abdominal, and the QL, all of those things. And particularly like that 2 inches or so from the very top of the crest going posterior, there's so much going on right there, and it's really nice to work that. So I'm just going to start there. I'm going to work this space.